This is Craig Rubenstein. I practice in both Long Island, New York, and in New York City. The next case, which will be my 8th, I believe, is very interesting, mainly because I was shocked when I examined this gentleman that I was really only finding one finding, and that is unusual in and of itself, and because of the nature of his problem and how many different practitioners he had seen, I was a little leery that this one finding could be the crux of the whole problem. It was a gentleman who was probably in his early 30s, who was a competitive volleyball player, complaining of lower leg pain, especially with exertion. He would play and his legs would give him a lot of problems. He was having difficulty competing anymore and did seek care from a number of different practitioners without getting a lot of relief. He even went through some difficult tests, one in particular for something called Compartment Syndrome, where a needle is inserted into the lower leg to measure the pressure within the muscular compartments. And then after measuring that pressure, they would have someone go on the treadmill and really exert themselves, and then come off the treadmill, insert the needle again, and measure the pressure. Not the most comfortable. He did show a positive test on one side, but he did have the problem on both, and he really didn't seem to me to have the real classic symptoms of compartment syndrome, other than exertion definitely created the symptoms. So upon examination, I found basically one thing, and that was weakness of a particular muscle called the posterior tibialis. It's below the knee and it controls bringing the foot down and in, has a lot to do with support of the arch. Now, other than a few other little pelvic findings and things we would find on anyone, whether they had symptoms or not, this really was the only finding. On top of that muscle being weak, I also found that it was very tight. Now, this muscle, when it's a problem, especially the tendon of this muscle, you can develop what are called posterior shin splints. Many of us have heard of shin splints in the past. Normally, that would be on the front of the shin, and that's called anterior shin splints. The posterior shin splints, which actually have a new name now that I'm not up to date on, I apologize, but the posterior shin splints cause a deeper pain inside the leg. Now, when you find a weak muscle, it's one thing. When it's also tight, that definitely winds up putting a lot more strain on the tendon, as the weakness of the muscle cannot withstand the work that it has to do. A lot of the tension or the work has to be done by the tendon, and then the tendon can get very inflamed itself or at its attachment to the bone. That could be a major problem. Now, when I treat anterior shin splints, I can usually get right into the muscle and work on the attachment of the tendon to the shin bone. With the posterior tibialis and the posterior shin splints, that is not so easy. But that muscle is able to be treated in a few other ways. When you find weakness, sometimes it's the muscle itself has been sort of shut off due to certain muscle receptors. That was not his case. It turns out, as all muscles have found to be related to different acupuncture circuits, the posterior tibialis has also been found to relate to different acupuncture circuits. So I was able to use some types of acupressure, rubbing out different points to strengthen the muscle, and that did work very well with him. And we were also able to use a machine called a percussor. It's like a massager, but a little bit different. And we were able to get into that muscle. That muscle is deep to the calf muscle, so you have to use the percussion instrument a little deeper than you would normally. But we were able to loosen the muscle with percussion. Surprisingly, and I really say surprisingly because I was shocked that this was the only finding I had in the first place, after a few treatments, this gentleman's pain reduced significantly, and he was able to do a lot more exertion before getting pain, And even though his pain sort of moved around and the symptoms were changing, it was getting less and less and less over time, to the point that he was able to compete in volleyball and really had little to no symptoms at all. So, interesting case, something very different. It shows us how the acupuncture system can be involved in even structural cases, and how each muscle, because it relates to the acupuncture system, we're afforded another way to treat muscular related problems. Hope you enjoyed it, and we'll have another case soon. Take care.